Hello everyone, just to let you know this session is recorded today. So today we're going to go through engaging patients to use the system. If you don't mind going on mute if that's okay, unless you've got any questions, that would be great.
Yeah, you won't be able to access.
Brilliant. Any questions as we go through, please let me know. You can either type them in the chat or you can pop your hand up and we can go through them. There will be some time at the end of the call as well to go through any questions you may have. And also feel free to reach out to us at training@engagehealth.uk with any follow-up questions or if you want to book in any training sessions with the team. So you should all be able to see my screen. So today we're going to go through how to engage patients to use Engage Consult and the methods that you can use to do that. And at the end, I will go through our recent releases and sort of our upcoming releases as well to make you aware of those as well. The recording of this session will be sent out after the call as well, along with any resources that I show you today, so you'll have access to them all after the call. I will send them out to you. So first of all, obviously, to engage patients, the first one is your website. So making sure you add a button or a banner to the top of your home screen to advertise Engage Consult, making sure it's clear where to click to access it, and just making it really easy for the patient to go through and submit those requests. So a lot of the time, I like this example at the bottom here, where it says contact our doctors online. So it's nice and clear and simple and easy for the patient to understand as well. As well, if you've got quite a cluttered website, making sure it's at the top of the website, it'll be the first place that patient looks when they are looking for those kind of details as well. Another good one as well, obviously sending through an online consultation is contacting the practice. So if you actually add the information about Engage Consult under the Contact Us page on your website as well, that can be a really good way to capture patients. But also, as you do that, add some text around what the service is used for. So some patients aren't aware of what they can use the service for. So give them some information around that, what they can use it for. And also we've got our banner as well you can add to your home screens to link across to your Engage. So when you're thinking about adding information about what they can use the service for, make sure it's clear, what they can submit through to the surgery using this platform. And I also find it really useful to pop in your response times within that text as well. So if you add in your response times, the patient knows when you'll get back to them. Because sometimes from patient feedback, I see that they say, they went through and submitted a request, but then at the end it told them, we won't get back to you within within 2 working days. And if it is a bit more of an urgent request or they need an answer sooner than that, they might then call the practice as well. So to kind of try and help not getting those sort of duplicate requests through from that patient, I would always pop your response times on your website so they're aware of that before they start that journey. It's also really useful to pop in your service hours as well. Normally I find the service hours for Engage Consult is different to your opening hours. So it's really good just to let patients know, what times they can use a service and when it's open from until. We've recently also updated our user guide, so I'll send these on a link across after the call, but they are on our support portal under the Engaging Patients section. And basically, the user guides just tell the patient how they can sign up for online consultations with the GP practice if they haven't used the service before. So there's a detailed guide there which will take them through that, but also how to send a message as well to their GP practice. So you've got those guides there. It's always a good idea again to link them on your website, or you can send them out to particular patients who may struggle to use the service. So they've got that information there, and then it takes that burden off your team as well, having to explain how to use the service. So there's a few resources on the support portal, as I mentioned. I would always promote to, link those on your website so they're easily accessible for that patient to download and be able to use the service easily. Another good way of engaging patients is through social media. and your phones as well. So as a patient, if I'm calling through to the practice and I'm 10th in the queue, for example, add in a message there to remind them to use Engage Consult for all their admin and medical requests, obviously depending on what you take as a practice. And the benefits to that, so obviously for the patient, it will save them time waiting in that phone queue. They've got time to get across their condition without having to rush. So they can take their time in typing that answer across to you. And we find especially we get feedback around that as well. If they have mental health issues, they like to have the time, not feeling pressured or rushed. They can take the time to go through and submit their answers without having to do it on the phone. So that's a really good way to signpost patients off from your phone to send them via Engage Consult instead. This will obviously then reduce your phone calls through to the practice, but also when you get those requests in, you'll get a lot more detail around that request for you to triage that more effectively as well. We also recommend advertising it on your social media pages. So put up regular posts, you can schedule those to go out. You can add our banner as your image if you wanted to, so they know kind of what to look out for on your website when they go to send that through. And again, gives them some information around what they can use the service for. Add the link there so it's nice and easy for them to access. Because what you'll find patients will do is they'll then favourite that on their browser so they've got for that next time they need to contact the surgery. So they don't always go through your website first to access the portal. And then if you've got the NHS app as well, so if you're not sure if your practice has the NHS app enabled for Engage Consult, please reach out to me at training@engagehealth.uk and I can check that for you, but also I can enable that for you from a click of a button. And basically what that means is the patient will then be able to go through their NHS app to ask for help, whether that's admin or medical. It follows the same route as if they went through the patient portal. But the benefits to the practice is when that request comes into the Engage client, it will automatically match and verify that patient from their details in the NHS app. So it actually saves you admin time as well when going through his request, because you're not having to verify and match that patient, because that will all be done for you. And obviously for patients who do use the NHS app, it's useful to be able to send through those messages just from their app without having to go to another website, for example, to get that link. So that can also be a good way to increase, requests coming into the system and keeping them off your phones, emails, etc. Just streamlining that communication from patients into one service. So as I say, please reach out if you're not sure if that is enabled or not for you. We will be doing a campaign as well out to promote this. So always just let us know and we can either enable it for you or just check if it is enabled for your practice. And then you've got your SMS/email option. So actually sending them a text to notify them of the system, adding it to an email. So perhaps you've got a practice email, you can add that to your out of office reply, for example. If you're querying about a sick note, please submit it via Engage Consult instead, because then it's easier to get that information into the clinical system without having to copy and paste it over from the email into your clinical system what that patient has queried. So again, it's just trying to streamline all the communication from your patients into one system. Actually at the practice, so when your patients go into your practice, you could add a message on your touchscreen to inform them of the system that you use to contact them. You can add the leaflets in your reception area. So we've got a new leaflet out, which again is on our support portal. You can either print that out or have a digital version on your website. And it just again informs them of how to use the service, what to use the service for, etc. It's just a general sort of overview of Engage Consult for them. Always handy to promote that service to them so they are aware of what's available to them, because again, from patient feedback, sometimes I see I wasn't actually aware of this service until I stumbled across it on the website, for example. So always promoting it in your practice is a good way to engage those patients. And then we also have that leaflet as well, which is a good one for your information boards or to sit by the receptionist's desk. And what you can do, you can add your QR code, so we can help you with that if you're unsure, to link to your Engage Consult for your practice. So the patient would just scan it on their phone and it would take them straight to that link, so they can then go and favourite that on their browser, etc., for the next time they need to contact you. And again, it gives them some information around how to use that system. We actually used these leaflets at a PPG event. We handed them out, so they had that information there, but also put them on reception desks, etc., and it worked really well. Patients then took them away. They had that information for next time they needed to contact you. So again, that's a really nice, easy option. You can print them off in small print, so that patient has that for next time they come into the surgery. We've also got, when you're sending out any sort of patient communication, so if you send out sort of regular newsletters or regular updates, especially for like new patient registrations as well, adding that into the pack. So, you know, sign up for Engage Consult. This is the way you contact us, for those non-urgent medical and admin queries. So getting them from that first point they register with you to use the service, but also in your newsletters as well. We've got some sample text, which again we have on the portal you can use. And you can just go in and edit it with your response times and your web link, for example. So again, it's easy accessible for them to go and find. They're then aware of the service and what the service offers. And obviously, as practices use it all slightly differently, you can configure that to how you want to use the service. So you get in the requests that you want to deal with that way. PPG groups are a really good way to do that. So I have attended a few as well, to talk them through Engage, and you get really good feedback from them. So, you know, is it easy to find on your website? How do they find the system? Is there things you could change to make it more accessible for them? So it's definitely a good one to promote. And then obviously they can then talk to other patients as well and encourage them to use the service too, which is always useful. And then kind of more like from your end, so in the Engage client, there's just a few things to think about when you're, you know, choosing the settings that you display to your patients. One of the big ones is your demand management. So we always recommend to open up the service before you open. So for example, if your practice opens at 9 AM, 8 AM, open up your Engage Consult at 6 AM, 7 AM. Because that then encourages patients to use Engage Consult over phone in the practice. So they're not going to wait till 8 AM and then phone, and then obviously you have that huge phone queue to get through. You'll have those requests submitted in the inbox ready to triage as soon as you come in. It encourages patients to use the service as well. And also think about your times for each day and your request limits, because if you have your request limits too small, patients, if they keep trying to get through to the service and it says, you know, you can't get through because they've reached their limit, it will put patients off doing it, and then they will just phone call instead and they won't try use Engage Consult again. So it's really worth thinking about that and how many you can deal with, because at the end of the day, it should then reduce your phone calls into the surgery. And if you want to encourage them to go through Engage Consult, so you get all that information there, so it's easier to triage, it will obviously then benefit the practice. They won't be coming through the phones. They'll go through Engage Consult and you've got all that information there ready, and easy to put that into the clinical system as well. We also do allow the option, so you can choose whether to allow users to send requests outside of service hours. Now you can choose that for either medical or admin or both. So after, on my example, after 5 PM, patients will still be able to submit that request, but it will just tell them, you know, your request won't be seen today. So they're aware of that as they go through and throughout their journey, but it might just be like a general admin query that isn't urgent, doesn't need to be seen that day. So, you know, it can go sit in your inbox ready for when you can respond to that request. So it's really worth thinking about your demand management, and if you've got it open enough to make sure patients are utilising it to its fullest potential, because if they can't get through Engage Consult, they will just then call up the surgery instead. And then you've got your configurability around the system as well. So looking at your patient feedback, you might see feedback around the questionnaire. So maybe have a look at that, review that and decide if for your patient population, if you're best to actually use the ICE questions, which is your ideas, concerns and expectations. So that's those set questions that you can go in and configure kind of what information you would need from that patient about that complaint. And it's just like a free text response from that patient. Some practices have switched over to it and actually finding they're getting more information back from those patients as well, because they're able to sort of type it into their own words instead of being directed down a certain route. So that might be something you want to consider. Or you do have those instant medical history questionnaires available as well. So it's down to you as a practice and kind of what your clinicians find useful, the amount of information you'd find useful to get back from that patient. But it's something to review, because if you are using IMH, for example, obviously you do get a bit of a longer questionnaire, and again that might put your patients off. So you might want to try those ICE questions and see if that then increases uptake, and notify patients that you've done that you've changed those questionnaire types, because if they've used it before and didn't get on with that particular questionnaire, they probably won't use it again. But if you notify them, you know, we've updated it, it's now easy to get your point across, etc. It might then encourage them to use it again. So that's all set in your management console, so you can choose what questionnaire you would prefer your patients to answer. You've also got that new configurability around the admin query types. So as a patient, when I go through to submit an admin query on the patient portal, it gives you those set list of admin query types, and you can now actually go in and configure those. Again, is something I would recommend reviewing, because there might be some things that you want to change and update and add in your own ones. And it just, again, it helps the patient, it directs them down the right route so they know they're sent, you know, they can send that request through the service. So for example, you might want to add an admin query type of update their personal details, which is a nice, easy one. So they, you know, as they go through to submit an admin query, they can see that, they can select that option and then give you the information you need. So again, that's all in your management console, where you can go in and edit those admin query types and really sort of personalize it to your practice and what you take through the system, instead of the patient just popping in something else. And then you get the option as well to then route them to a particular colleague to deal with, which is always useful, again, saving you admin time in dealing with those requests. And then obviously you've got the patient portal. So this is what the patient will access. And it's really important to make sure it's clear to the patient, you know, what each service is for. So on mine, I've got the Start an Online Medical Consultation. We used to have that as request help from surgery. So you might just want to go in and see if you'll still say that and update it, because we've now got the medical and the admin route separately as separate services. So you might want to go in, or maybe contact a doctor online, you might want to call it, just to make it more clear for your patients which button to click from. Again, from patient feedback, sometimes I see they're unclear to which route they should go down for their query. So you can also edit the text underneath those buttons. So for the medical consultation on our example, we've got contact us about a new or existing medical condition. But under submit an admin query, we've got contact us about sick notes, prescriptions and other administrative queries. So you can edit that text there to tell them, you know, what to use that service for. And then as they then click through, again, you've got this text here, which you can edit. Again, sort of notifying that patient what they can use the service for, what they can send through. And you can also link them across to other services as well if it's more appropriate. So I take a look at that for your practice, see if yours is updated. If you need help with that, please reach out to us and we can help you with that. But it's just keeping that patient informed throughout their journey. And I also recommend popping in here your response times. So for an admin query, you might have a different response time to your medical query. So you can pop that in here. So as that patient goes through, they know straight away how long, you know, it'll take to get a response back. So they're not then trying to call you, asking you for that information. You just have to submit that, supply that information once to that patient. And also think about what other links on here you could put which will help your patient. So if you use patient access for repeat prescriptions, for example, add that as a button so they've got it all on their patient portal instead of having to look on the website for that sort of information. Any sort of referrals or anything like that you can link on here. So all you need is a website link to add these particular buttons to the portal. Just to make it clear for them again, because if they save this on their web browser, they might not necessarily go through your website. So have a think about that, and what you display on your website, you might want to also display on this patient portal for them. So they've got it all on one system instead of having to look at multiple. So you can go and view your patient feedback. So we do ask the patients for feedback after they've submitted a request, and you can go and review this feedback on your reports, which I'd really recommend. I review it on a weekly basis, so your feedback from your patients, and you really find some insightful information around there. You know, is it easy to find on the website? What do they think of the service? Some of them hadn't had a response yet, so then you can then go in and have a look and sort of investigate those further. So it really is useful information to go and have a look and report on, and sort of pull that report on a regular basis. And also, if you did change your questionnaire type or change something about your patient portal, you might then see your feedback improve or decline. And then from there, obviously, you can then go up and update your settings to make it more clear for that patient. So you'll see on mine, I've got these graphs. So you'll soon have your reports in your management console, and you'll be able to pull that information a lot easier instead of having to go to my.engage.gp like you do at the moment. So that should be coming from tomorrow, which I will show you how that will look for you. We've also added a new patient feedback question. So you'll be able to pull or report on that as well. And the questions around if they didn't use like Engage Consult that day, what would they have done? Would they have telephoned the surgery? Would they have contacted 111 potentially? So that will be useful information as well to see what that patient would have done if they couldn't get through on this particular system. So that's kind of the main ways to make sure, you know, you've got that information there for that patient. So whether that's through your website, through your social media, sending out those text messages, on your phone lines, in your practice, sort of covering all bases, making sure your staff are promoting it as well. I always find that really works well. If, you know, if I'm a patient, I call in, the staff tell me, did you know that we have an online solution now? You can submit these requests. You wouldn't have had to wait on the phone, especially if it is a request that would be best dealt with online. So, you know, promoting that to the patients is always important. And if you promote it yourselves internally, you will find you will then see an increase in the service. But just make sure you've got your demand management set so you can see an increase in that service. And then, you know, review your call logs, see if you then see a decline. So that's the best way to make sure you are getting benefit from the system, and sharing that with your staff as well to show them, you know, by opening up the system, by promoting it, we've now reduced our phone calls by this amount. Is there any questions so far? Please pop your hand up if there is, or pop it in the chat. Go ahead, Alex.
Hi, Anna. Thanks for the presentation so far. I had a question around about service hours.
Yeah.
You know, it's great that you've got this ability where you can sort of half turn it off to say, you know, we don't want, you know, we're going to respond to your request the next day, which I think is great. But we've got this little bit of an issue with the weekend. So we don't really want to have someone contacting us, say, at 7 p.m. on a Friday.
Yeah.
About, for example, mild symptoms of a UTI, and then for them to brew over the weekend, and then they contact out of hours, and it's all been dealt with, but we have to reply to their consult on Monday, if you know what I mean. So obviously you can sort of turn off totally Saturday and Sunday, but it's just the issue for Friday evening. Have you thought about that? Is there any way around that?
So currently there's not a way around that, but that's a very good point. So you'd like the option to be able to sort of not have out of hours on a Friday evening.
Yeah, because I mean, what we'd probably do is turn it on Monday morning at midnight, so that patients that want, have a medical problem that they want dealing with can submit a consult from whenever they get up. But we don't really want them trying to contact us, say, on a Saturday morning, because if their condition deteriorates, we'd really rather them use the out of hours provider, which that's what it's there for. So it's just to capture the ones that we want, but not get ones that we don't really want, basically from about 6 o'clock or maybe even 4 o'clock on a Friday forward until that point where we're happy to accept them again.
Yeah, no, that makes complete sense. What I'll do is I'll feed that back to the product owner and see if that's something. Maybe we can add more configurability to that demand management setting. So you could actually put, on Monday I'll accept out of hours, but Tuesday I won't, Fridays I won't. So yeah, I'll definitely feedback that back. That's really great. Thank you, Alex.
Okay, thank you.
Brilliant. Any other questions before I move on? No, brilliant. So just to go through kind of recent releases we've had and what's coming soon. So recently we released the ability to add simple questionnaires to your patient portal. So you can actually go and add a button for smoking status, for example, for a patient to kind of self-serve you that information, which then comes into the system coded. And obviously click of a button, that information will go into your clinical system, or you might want to actually direct patients to go and fill that information in. So you're not having to send that out to each patient. Obviously you can as well, but it's just another option. So they can be any of your simple questionnaires you add. So that's either your smoking status, ethnicity, epilepsy review, medication review. You can choose what you'd like to display. And also another one from practices feedback is we've now added to messages. So when you send a patient a message, it will tell you when they've read that message, which I think is really useful if you've sent them something important, but they might not responded. You can actually make sure they've answered, read that message and, took that information in. So coming soon. So all of this is actually coming tomorrow. So when we have our release tomorrow, we've now added reporting in the management console, which I'll show you. So you don't have to go to my.engage.gp. It's all in your management console, so you can go and self-serve yourself those reports. And also they've been improved as well, so it's a lot easier to pull that data. We've also added status to a request, so you can go in and add a status to that request, whether that's triaged. Also another one from practice feedback we've added is to mark that request unread. So perhaps you've clicked on a request you didn't mean to, you can now mark that unread or for any other reason. And we've also enhanced our total triage offering. So what we've done for that is when you go and create a request on behalf of a patient, you will be able to go in and select if you want the ICE questions to display to whoever's taken those requests from your patients. So whether that's your receptionist, admin team, for example, you can now choose to display those ICE questions the same as you do to the patients. You get the information you need from those requests as well, instead of just having that one box. So that's down to you as a practice again, depending on what you would find useful and what your staff would find useful. So if I just show you those new releases. So first of all, we'll go through the reporting. So it's anyone who's got access to the management console will be able to view this. It'll be added as a button on this left-hand side. And you'll have the same reports as before. So you've got your feedback, so that's your patient feedback. You've got your medical consultations. So you can see like your top 50 matched complaints, for example. You can see your transactions and you can see your usage as well. And you'll be able to go through, select the time period. So if that's the last 90 days, maybe just for July, last 7 days, you can choose. And then you will go down and you'll be able to see any patient feedback that has been left by your patients. You'll also have a graph as well added there, like I did on my screen, pulling that information together. And you'll be able to go through and download these as CSV reports. So you can go manipulate that data elsewhere and you can share these as well. So that's our reporting feature. And then we've got the new status on requests. So you'll see we've got these new symbols as well, depending on the status. So on this particular request, we've had a new response from the patient. So again, I can see that just from the home screen. And when I actually click into that request, you'll have a new tab at the top here, which is called Status. And you can go through and select what's happened with that request so far. So maybe you're waiting for the patient, it's been triaged, it's now completed, it's a new request. And when you then update these, so if I pop this one as triaged, for example, when I go to my home screen, I can see from the home screen that this particular request has been triaged. And I might want to then go and filter those requests by that status. So I might just want to see all requests that have been triaged in my inbox at the moment. So you can really filter those requests down as well. So that's our new features that are coming tomorrow. You will see the release notes go out for that soon. And also what we've got coming soon is our Engage Consult app. So patients will be able to download the Engage Consult app on their phones. And what that will let you do is for the patient, they've then got that there to then go and contact you. So it'll be the same as the patient portal. They can go through and submit an admin or a medical request. But also you'll be able to send them push notifications. So when they receive a message from the practice, it can go via push notification. So obviously they'll get that message quicker than potentially via email. So that will be coming soon. So if that is something you're interested in, reach out and we can provide you more information, but we will keep you updated on when that will be live for our practices. Any questions at all from anyone? If you think of any questions after the call, please email training@engagehealth.uk as it says on the screen. And we're happy to answer any questions. Or if there's anything we've gone through today that you'd like help with, any sort of training sessions for your staff, please let us know and we can get you booked in to help you with anything we've gone through today. Brilliant. Well, thank you all for joining. I'll send out the details after the call, so I'll send out the recording and all the resources we've gone through today. As I say, any questions, reach out. And if you did want the NHS app enabled for your practice, let me know and I can enable that for your practice as well. As I say, it'll benefit your practice because it will save you on a bit of admin time instead of having to verify those patients each time. Brilliant. Thank you all for joining.